The next paper presenter, Dr. Haripriya from ARAVIND, endothelial cell loss following Phaco and eyes with pseudoexfoliation, a 10-year comparative study.
Thank you. My disclosures: the IOLs were donated by Alcon and CTRs from Morolab. None of the authors have any financial interest to disclose. Pseudoexfoliation eyes which undergo cataract surgery have been are at a higher risk for endothelial cell loss. This paper by Hayashi et al. Reported a 9% endothelial cell loss in the pseudoexfoliation group. The purpose of our study is to prospectively compare the endothelial cell density and the best corrected visual acuity in eyes with and without pseudoexfoliation undergoing cataract surgery. This was a prospective multi-centric study done in the 4 centers of ARAVIND eye care system over a 10-year period. The PX group included pseudoexfoliation eyes with visually significant cataract, and the control group had cataract without pseudoexfoliation. Patients who were willing for Phaco and had significant cataract were part of the study, and those on specular who had an endothelial cell count of more than 1,500 cells. We did not include patients who had either phacodonosis or pupils less than 4 millimeters in the pseudoexfoliation group. All patients were followed up at 1 day, 1 month, 3 months, and yearly thereafter for about 10 years following surgery. At the 9th year, we did not follow up these patients because of the COVID pandemic. The workup included refraction at all visits, applanation, tonometry, slit lamp photography, and pachymetry. We did specular at the pre-op, 1st year, 5th year, and 10th year post-op. The visual outcome was the secondary outcome variable, and the endothelial cell loss was the primary outcome variable for this study. So the number of patients who were enrolled were 930 in the pseudoexfoliation group and 476 in the control group. The mean age, the patients in the pseudoexfoliation group were significantly older. We also had more males and diabetics in the pseudoexfoliation group compared to the control group. We published our 1-year and immediate post-op results, where we concluded that pseudoexfoliation eyes without the intraop or pre-op zonulopathy were not at a higher risk for intraop or post-operative complications. And the publication at the 5th year, our results were that the risk of IOL decentration or PCO were low in pseudoexfoliation eyes compared to the control group. At the last or the final follow-up at the 10th year, the death was about 21.6%. So excluding death, the follow-up rate was about 82% in the control and 86% in the study group. It was 65% follow-up rate if we included death and loss to follow-up. The endothelial cell density at baseline 1 year, 5 years, and 10 years was lower in the PX group compared to the control group. Also, at the final follow-up, we found the endothelial cell loss was lesser at the 10th year than the baseline in both the pseudoexfoliation group and the control group. About 3 patients had 3 eyes had corneal decompensation, 1 at the 5th year follow-up and 2 at the 10th year follow-up, of which 1 underwent PKP and 1 underwent a DSEC surgery at the 10th year follow-up. The endothelial cell loss at the 10th year, the assessment for risk factors, we found that those patients who were over 60 years had a higher risk for endothelial cell loss, and those who had nuclear opalescence of more than 4 on the LOX3 grading also had a higher risk of endothelial cell loss. The glaucoma did not link any risk factor for endothelial cell loss. The pachymetry at all visits, we found the central corneal thickness was comparable between the PEX and the control groups. And moving on to visual outcome, at visits year 2, year 3, year 6, year 7, and year 8, we found the visual outcome to be significantly lower in the pseudoexfoliation group compared to the control group. However, this was not very significant clinically. It was less than half a line difference, although this was statistically significant. In conclusion, in this long-term large prospective study, we conclude that in uncomplicated pseudoexfoliation eyes, the endothelial cell loss was similar in the PX and control groups, and the endothelial cell count was lesser in the PX group compared to the controls at all visits. And the visual outcome was marginally better in the control group compared to the PEX group. Thank you.
Thank you, Dr. Haripriya. How were you doing the endothelial cell counts, and who was doing this?
It was done by a trained technician in the cornea department, and they were blinded to which group the patient was, whether it was pseudoexfoliation or it was a technician, it wasn't an ophthalmologist.
Okay, thank you.
Did you manage eye-wise, patient-wise?
It was one eye per patient. We did not take two eyes per patient. It was 930 and 476 each patient of each eye of each patient.
One eye.